Now, in second part of Unit 3, Grade 10 English, no, health and wellness. Here exercises. Match the word in column A with their meaning in column B. Here column A and column B. Now in column A, nightmare, and then pediatric, and here treatment using drug, a thing that is regarded as more important than others. Here nightmare 3 number, and then pediatric, that is the 4 number. Here yes, 3 number are very unpleasant and frightening experience and relating to a medical care of children. Similarly, intravenous, that is 5 number, into or connected to a vein, and priority, that is 2 number, no, and medication, that is here 1 number. Similarly, confidente, now 9 number, a person with whom private matter and problems are discussed. And similarly, deprivation, and 8 number, the lack of something considered to be a necessity. And vulnerable, and that is 6 number, and indeed in need of social care, support or protection, that is, and dreadful, that is here 7 number, a very bad or unpleasant. Now similarly, write true for true and false for false statement. The sender of the letter was happy with the health workers service. Certainly not. That's why false. The staff of different departments in the hospital had harmonious relationship with each other. Certainly there, that is also false. Note the good relationship. The hospital staff were concerned with the requirements of the sick child. The hospital staff were concerned with the requirements of the sick child. That is also false. The staff of the hospital shared their personal feeling with the writer. Certainly true. No, the chart was unclear about the patient's gender. No, here, chart was unclear. No, that is the true one. Similarly, the author took the mistakes of the health workers normally. That is false. And similarly, the writer seems to be more sincere in her duty than the hospital staff. True. Now answer the following questions. What was the nightmare for the author? Yes, her 9-week-old baby developed an extremely high fever was a nightmare for the author. What do you think the main purpose of this letter is? No, I think the main purpose of this letter is to give feedback on frustration and disappointment with the hospital staff's lack of empathy and professionalism. According to the author, what was the main weakness of the hospital staff? No, according to the author, the main weakness of the hospital staff was their lack of team spirit, professionalism, and irresponsibility to patients. Similarly, did the nurses really say your daughter is not a priority? Why did the author think so? No, the nurses didn't say so. They repeated a statement that they were so busy that they made the author think so. Now, what do the patients and their families expect from the health workers? Yes, the patient and their families expect from the health workers to listen to them and care for the patients. List the questions that the author was asked frequently in the hospital. Yes, the author was asked frequently the following questions in the hospital. Now here, was she premature? Was your delivery normal? Yes. Why did the health workers make a gender error about the author's daughter? Now, the health workers made a gender error about the author's daughter because her daughter spent time in the hospital wearing only a diaper and they even don't pay special attention to the paperwork. Now, according to the author, how do people perceive the care of health workers? No, according to the perceive means feel. According to the author, People perceive the career of health worker as a dedicated, noble, and respected profession rather than a glamorous profession. Oh. If you become a health worker in the future, what would be your priority? How would you treat your patients and their families? Discuss with your friends. Now here answer. If I were a health worker in the future, my priority would be providing compassionate and high quality care to my patient. I would aim to treat each patient as an individual, considering their unique needs, concern, and preference. Here's how I would approach treating my patient and their families. Now, establishing a compassionate and empathetic approach. I would strive to create a warm and welcoming environment where patients and their families feel comfortable sharing their concern and fears. I would actively listen to their stories, acknowledge their emotion, and show empathy towards their situation. Now, building a strong relationship. I would focus on building a strong therapeutic relationship with my patient and their families. This involves effective communication, respect, and trust. I would take the time to understand their values, beliefs, and cultural backgrounds, which can greatly influence their healthcare decision. Providing clear and understandable information. I would ensure that patients and their families have a clear understanding of their medical condition, treatment option, and potential outcomes. I would use plain language, visual aids, and other tools to enhance their comprehension. I would encourage them to ask questions and address any doubts or misconceptions they may have. Yes, and here you can involving patients and families in decision making. I believe in shared decision making. No, patients and families are active participation in their healthcare choices. I would provide them with the necessary information, explain the pros and cons of different options, and support them in making informed decisions that align with their values and goals. Providing holistic care. I would recognize that patients are not just their medical condition but complex individuals with physical, emotional, and social needs. I would consider the broader aspects of their well being and collaborate with a multidisciplinary team to provide comprehensive and integrated care. This may involve addressing psychological, social, and spiritual concerns alongside their medical treatment, supporting patients and families through difficult times. I would understand the emotional challenges that patients and families may face during time of illness or healthcare intervention. I would offer emotional support, connect them with appropriate counseling service if needed, and provide resources to help them cope with the stress and uncertainty they may experience. Discussing this approach with friends and colleagues can be valuable as it allows for different perspectives and insights. They might offer their own ideas and experiences which can help refine and enhance the proposed approach. Additionally, engaging in discussion with others can foster collaborative learning and encourage the exploration of new ideas and innovative practices in healthcare. Yes, I read it here, and if you would like to copy it, then you can. It's very nice answer. Now pronunciation here, like pronounce the following words and then put them in the correct column. Here, sartu and langu. Yes, cook, book, put, good, look, hook, stood, took, would, and food, mode, noon, roof, school, to, Jew, zoom, mood. In this way, you can pronounce the words. Now here, grammar first. Study the following table. Observe how the imperative sentence changes from direct speech to indirect speech. Now she said, keep quiet. She interested me to keep quiet. Here, please close the window, the teacher said. The teacher asked me to close the window. The doctor said, don't over it. The doctor urged me not to over it. Now, she said, take the test next week. She advised them to take the test next week. Similarly, he said, take a taxi home. He insisted on us to take a taxi home. He said to me, please wait here till I return. He requested me to wait there till he returned. In this way, if you want to know a lot about the direct and indirect speech, then I have given a very nice video in my YouTube channel. You can study nicely, deeply from there. And now change the following sentences into indirect speech. Beginning of each sentence is given. Please help me fix this machine. She requested me to help her fix this machine. In this way, don't please switch on the fan. Now the electrician requested me not to switch on the fan. Help me with my homework, please. Now here, my friend asked me to help him with his homework. Lend me some money, please. Now she requested me to lend her some money. And similarly, do your homework. No. And the teacher told me to do my homework. Don't smoke. No. The doctor urged me not to smoke. Don't make a mess. My mother forbade me to make a mess. Now, writing first. The letter in reading first talks about different weakness of the healthcare workers in a hospital. Imagine you are one of the staff of the hospital. Now write an email to the patient's mother apologizing for your behavior. Assure her that there will be an improvement in the services your hospital provides. Yes, here, writing first. Now I have written email, dear appreciative mother, because suppose I am the hospital staff and I have read her letter, then I am writing to you today to apologize for our poor behavior at the hospital. I realize my mistakes. We should be careful and responsible to patient. I understand that you are responsible and well equipped. We just criticize each other. I am very sorry for the poor activities that we made. In the future, I promise to improve your services. Our services. One potential improvement that hospitals can implement to enhance their services is the implementation of electronic health record EHR and across their facilities. Electronic health record are digital version of a patient's medical history, including their medical condition, treatments, medication, allergies, and test result. I know it's important to note that the successful implementation of EHR requires proper training of healthcare staff, robust data security measures, and compliance with privacy regulations to protect patient confidentiality. Nonetheless, the adoption of electronic health records can significantly enhance the efficiency, safety, and quality of services provided by hospitals. Having read your letter, we gathered for our team spirit. Thank you for your time and please accept my apology. Sincerely, yes, here the hospital staff. Okay, thank you for today.